Hey, we're talking about cancer today. Hi guys, so we're talking about cancer today. And the topic is symptoms of breast cancer. So let's get started. It might be disturbing, yeah, obviously, when someone very close to you is being diagnosed with cancer. You're like, there's no symptoms. We didn't really feel anything. Really? Yeah. So let's talk about the symptoms of breast cancer so that you can know for knowledge sake so that you can know really. So although we frequently hear the word symptoms and sign, so when I say symptoms of breast cancer or signs of breast cancer, real G's are like, come on, just go. Symptom signs. What are the things I can see that will make you think that you have breast cancer? Okay. Let me serious. When you talk about signs and symptoms, they're actually different things. What you notice, the abnormalities you notice in your breast are what you can call symptoms. Malaria symptoms, headache, body results, and so maybe you want to sleep in the morning. No sure. But when you talk about symptoms, they are the things that you notice. You know your body best, right? So when you start to feel like something is off, then those are symptoms. But when you then go to your doctor, you tell him or her the symptoms, and then they carry out, maybe breast examination, screening, test, and all various kind of thing to actually examine the signs for breast cancer. So when those signs are like, oh, we saw this, we saw this, we saw this, then it could lead to cancer. Do you understand? So the majority of breast cancers are symptomless. That means you really might not feel anything. That is why monthly checkup screening, not monthly, I'm sorry, but routine checkup that is why routine checkup, breast screening checkup is, advised because these things can be sometimes symptomless. So let's get started. Again, when you see me do this, I'm looking at my laptop because I really don't have everything up here. So there are common symptoms for all types of breast cancer. Remember in the last video we spoke about non-invasive, invasive, DCIS. What does that mean? What does DCIS mean? LCIS. What's the difference? And then we spoke about the invasive, breast cancer. So there are common symptoms that you see in all kind of cancer. The first one is a lump. Like when males actually do have lumps, but it's most common in female. Just like the way breast cancer is like most likely to be found in female than males, right? So the most common type, no, I won't want to use the word common, but like when you have lump in your breast, the first thing you think about is it is cancer. No, it's actually not cancer. It might actually not be cancer because some lumps are benign. So when you have lump in your breast, some can be painful, some can be painless, and then some can be hard, soft, tender. When you touch some might move a little to other part of the breast. But either ways, you need to see your doctor. Like immediately you detect lump. And detecting lump it's quite easy because I'm not saying you should be pressing your breast and be pressing it, but you can press it when having your bath or deliberately lying down and observing if you have lumps in your breast. I'm not talking to females alone. Male should actually do check it out, right? So lumps that are more likely to be cancerous are hard, they are irregular, they have irregular shapes. It doesn't mean that soft lump they are not cancerous. That's why I said earlier that you should meet with your doctor. So other common symptoms of breast cancer include the list that I'll be giving dishing out that you should look out for. Remember I said symptoms. So one is swelling of a part or whole of your breast. When you have swelling in a region of the breast, then you should ask question, why is this happening? Or when the whole of your breast is just swollen. I get the part that during menstruation, female have funny, hormonal changes. So it could be that during your menstrual cycle period, your breast is, a bit bigger or enlarged. But if after that you still notice that some part of your breast or all of your breast is just enlarged and you are not increasing in size, then you should go for a medical checkup. Then the next one is breast or nipple pain. This is very common to menstrual cycle. But when you are not having your menstrual cycle and then you are having constant and consistent pain in your breast or on your nipple, then you might want to go see your doctor. The third one is a nipple turn inwards. I'm going to try and look for a picture of that so that you can understand, visualize what I'm saying exactly. So when your nipple starts to turn inward, trust me, it occurs for male. So when your nipple starts to turn inward, then it might be. I'm not saying it is. It might be. The fourth one is red, dry, flaky, thickened skin around the breast and nipple. This is where you cover on a daily basis. So it's not expected to be dry, red, flaky, thickened. Then you want to go for checkup or talk to your doctor or oncologist. Then the fifth one is nipple discharge. That is not breast milk. It might even go as far as being as bleeding. So sometimes you might have a little discharge from your breast and you're not breastfeeding. That should be concerning for you. It's not normal. Why should you be discharging from your breast when you're not breastfeeding? So those are things you should watch out for. And it could be blood. It could be bleeding blood from the part. So the last one I'll talk about is swollen lymph node under the arm, around the collarbone. I'm going to check for a picture and put it. But when you have swollen lymph node under the arm, around the collarbone, then something is up. There are symptoms that allows you to know that, oh, this breast cancer is inflammatory. So there are inflammatory breast cancer symptoms. IBC are more aggressive. They are rapidly developing types of invasive breast cancer. Remember invasive breast cancer? So when you have inflammatory breast cancer, they are more aggressive. People who have IBC do not usually have lump. That's why I said the majority of breast cancer are, symptomless. Do you understand? So symptoms of IBC include breast swelling. We spoke about that earlier. It include breast swelling, skin color change in the breast. So we have breast swelling, skin color change in the breast, such as redness, then breast pain, consistent breast pain, skin thickening. You have heaviness in the breast. When you're not menstruating and your breast is just always heavy, you know you're carrying something, then something is off, right? Then the next one is dimpling of breast skin. It looks like orange peel. I'm going to get a picture of this because I'm familiar with that. So it looks like orange peel. Then something is wrong with your breast, woman or man. And then the next one is a feeling of warmth around your breast. I know you are not, exposing your breast to breeze, so it's most likely warm. But when you suddenly feel like your tummy is a bit warm and then your breast is hot or warmer than usual, then something is wrong. Breast changes that happen slowly over the months or years are most likely to be IBC. It's not like you just wake up one day and then you see the change. No, it happens, stage, gradually. And those are the more aggressive ones that you should watch out for in your health. So take it, you have a bath every day. You can be deliberate about going through these symptoms on a daily basis or on a weekly or monthly basis. Just get a routine and ensure that you are more accustomed with your body. The next set of symptoms I'll mention are specific for males. So common breast cancer symptoms in men are also similar to those found in women. The symptoms include one. Symptoms include one, a lump, can be a painless lump. but you are not meant to have a lump as as a male and even as a female. So once you, I know your breast is not big, right? But once you find like what's going on, is this a lump? Then you might need to see your doctor immediately, right? And the second one is swelling of part of your breast. Your breast is not expected to be big, so why should it be swelling? If you're not using the gym and you're not expecting that your breast should, muscle should increase, I guess. So you should know that something is wrong when you start having big breast. So when it's swollen, then you might need to see your doctor. Then the next one is skin dimpling or puckling. Nipple becomes to turn inward, and then the next one is red or flaking. I mean, I mentioned this for female. The fifth one is nipple discharge. My hand is stuck on silver, got into like six. Nipple discharge. You're not breastfeeding, man. You shouldn't be discharging from your breast. So you want to go for that checkup immediately, right? So when you have swollen lymph node under your arm, see your doctor. Again, thank you for sticking to the end of the video. Share it to people so that they can become accustomed with what is happening in the science world with cancer, and also to become vast and familiar with their body. Know about your health. I mean, you don't need to wait till you are diagnosed. I'm not saying checking for these symptoms doesn't mean that you get cancer tomorrow. It's just for you to be safe and also for you to help people around you that are most likely not educated. Thank you. I'll see you in my next video.